My name is Shane Whitlatch. I'm an Executive Vice President here at FairWarning, responsible for customer value creation. And the story I'd like to share with you today is about my primary care physician. I've been going to him for years, maybe 7, 8, 9 years, I'm not sure, for quite a long time, and have developed a relationship, over many meetings, many annual visits, and so forth. And through those years and through those visits, I've educated him, I think, about what we do at FairWarning and some of the threats that we see facing, not only hospitals, but physician practices and so forth. And during a recent visit, he walked in, and as we started the visit, before I even said why I was there, he said, Shane, I have to thank you. And I was, okay. And he said, because of the education or the information that I've shared with him over the years, he's become more aware, more sensitive to the various schemes and threats and fraud activities out there. And the story that he shared with me, why he was thanking me, was that his office manager received a call from a pharmacy in Virginia, out of state obviously, to refill a narcotic for a patient of theirs. And the reason that I guess she flagged it first was that the narcotic is one, I guess, it's commonly abused. So it's whatever it is, pain med, I'm not sure, but that patient evidently had just refilled that narcotic sometime in the recent days or weeks. So it was odd, that he was refilling it. She brought it to the physician's attention, and his first thought was, this is someone who is abusing it or who's selling my scripts or something, and we just need to cut him. It's common, unfortunately, and we just need to get him out of our practice and not treat him anymore and not fill that prescription. But then when he looked at the name of the patient and spent a little bit more time thinking about it, he said he was felt with, it was disappointment, I think was the word that he used. And the disappointment was because evidently this patient was someone who, probably like me, has been going to him for quite some time. But then he remembered all the things that I had mentioned about medical identity theft and how creative criminals can be, and he thought, I'm going to call this person. So his first thing was cancel, get this guy out, we're not going to treat him anymore. But because of his awareness of the risks that we help our patients, our customers with, or address, he called. So he took time out of his day and he called that patient to see if he in fact was in Virginia, if something was going on. And essentially the story is that someone stole that person's identity, and not only were they trying to fill that prescription in Virginia, but they were also trying to fill it in another state, I think some southeast somewhere. So that person was like, no, I'm here, that's not me, I'm not in Virginia, I'm not in Tennessee or whatever the other state was that they found out, and figured out that his medical identity had been stolen. And so they opened up a case, and he doesn't know what the outcome of the investigation was, but the result of that was he restored that trust, or was able to maintain that trust that he had with his patient, as well as informing his patient, someone may have your identity, in fact someone did steal his identity, and was able to start repairing that, whatever that may be. So, and all of that came from our discussion and education over the years about what we do and how our software and our services help our customers kind of protect that sensitive information or that trust and restore that trust between them and their patients.